Today we are talking about the journey of breast surgery. So the first questions we have for you are you happy with the size? Or do you want to be bigger? Do you want to be smaller? And then we go from there. If you want to be smaller, we know you're probably talking about either a reduction or a lift. If you're thinking you want to be bigger or you think you want to be perkier, those are both terms that lead us down the road to say you're looking at a breast augmentation. Let's say you come in and say, I'm happy with the size of my breasts, I just don't like where they're at. Okay, now we are talking about lifting the breasts up onto the chest in a higher position. We have a few different types of lifts that we perform. Those are based upon, one, your desire, how high and tight do you want to be? And two, and this is probably more important, it's what you have. What is your anatomy that you're starting with? And what you're starting with really determines the type of operation that's going to be right to get you the proper result. When you come in knowing that you want your breast to be smaller, so we start talking about breast reduction, our next questions are how much smaller? A little bit or a lot? And so we will use a discussion about cup sizes to give us some general guidelines. We can't get exactly to that. We can't make you exactly a small C. Those things change from bra to bra. When you come in and say that you want larger breast, we know that we're going down the road of breast implants. In a very few patients, it might be something where we discuss fat grafting to the breast, but that only does a very minimal increase in size. It doesn't get you a lot of increase. So for almost everybody, it's implants. So we're gonna have discussions about different types of implants, saline implants, which are filled with salt water out of an IV bag, or silicone implants. And there's a lot of different types of the silicone implants to discuss. Breast implants can give a little bit of lift to the breast, but they can't give a lot. And if your breast is droopy or really deflated after breastfeeding or weight loss, or that's just who you are, then you may require a lift. And so now we have to discuss the different types of lift that we can combine with a breast augmentation. If you're interested in breast surgery, in augmentation, lift, reduction, or a combination of those, then schedule a consultation with us. You can do it online, Austin-Weston.com, or you can give us a call, 703-893-6168. We're happy to see you here.